Dr. Madden, do you have evidence of the medicinal value and properties of marijuana that could help people who have, well, maybe they're a cancer patient, have multiple sclerosis, or a myriad of other conditions?
Absolutely, and I think the information continues to expand. Again, as we've had some states go medical with respect to legal abilities to research, we continue to get more and more studies that show benefits not only in pain management but in immune disorders. It's a wonderful tool, and the interesting thing in most of these studies that you won't see with respect to many of the other therapeutics, regardless of class, is the safety. Opioids, benzodiazepines, all have potential overdose risks, which really don't exist in the
So there's never been an
system.
Overdose for marijuana?
Not that I'm aware of, not in any clinical trials or studies.
Is it possible to OD on marijuana?
Well, I think it's possible to overdose on anything. Too much of aspirin or over-the-counter Tylenol or even ibuprofen, anything can shut down your system. And again, we don't know everything about all of the different chemicals within it, but within any of the studies done, safety, efficacy, tolerability, reversibility of negative or adverse events exists, and I think there's a wealth of clinical evidence to support that.
Is it addictive?
Addictive, yes, to a certain extent, although I think in comparison to things like Valium or other benzodiazepines for seizure disorder, or obviously with considering the opioid epidemic, I think it's much less addictive and overall much less harmful than even things perhaps like tobacco or alcohol, which are legal.